Hi everyone, in today's video we are doing a toxin treatment. We are starting with my patient's frontalis. I personally do not mark, but if you wish to, you can always start by marking your lateral borders, but I am just moving from one side of the frontalis to the other. You always want to ensure that you are starting high. For this patient specifically, she does have some genetic hooding over her lids, so after some toxin treatment, she has felt heavy in the past, so here we're just making sure we are staying high, and I have her raise her eyebrows periodically just to make sure we are getting full coverage. But just going ahead and adding a few more closer to her hairline. We also do a pretty low dose for her as well. Like I said, in the past she has felt heavy, so we are just staying high, and we decreased our dosing as well. She's also on the younger side, so she really doesn't require a lot of treatment in this area. We're more just doing it to prevent. So now we're moving on to our glabella. Golden rule in aesthetics: if you are treating the frontalis, you have to treat the glabella as well. This is a depressor muscle, so it pulls down. So treating this area will help elevate and give her a little bit of a medial brow lift, which again, she does have that hooding over her lids. So this just helps compensate for that heaviness she feels in her frontalis, as well as give her a visual lift in this area. When we move on to her crow's feet, we do a medial and lateral brow lift for her as well. But just making sure I am keeping some gentle pressure underneath that orbital rim just to ensure we don't have any diffusion. And I do 2 injection points, one for that medial area and then a little lateral as well. I'm using ComfortTox syringes, so these are multi-beveled, but I do switch my syringe for each injection point just to make sure it is comfortable for the patient. But that first injection point there was for the lateral tail of her brow and just moving in a C-like formation. Again, this patient is young. We're just mostly preventing. She doesn't have a lot of static lines in this area. But if I am doing a brow lift, I like to at least treat a little bit in that orbicularis oculi muscle just to ensure we're getting adequate lift, as this is all the same muscle and it functions together. I'm kind of palpating that orbital rim as I go along as well, just to ensure that I am staying just on the outskirts of that area. And this is also a very superficial injection, and as I move from top to bottom, I'm actually coming a little bit more superficial as well. And just finishing off with that brow lift. And this patient also gets chin filler, so I always treat her chin. I do a pretty decent dosing here of 8 units. I do 2 just for texture, a little bit more superficial, and then a deep injection as well to help with projection.